And welcome to all of our listeners and viewers around the country and around the world. The Republican-controlled House this week voted to repeal President Obama's signature health care law by a margin of 245 to 189. 3 Democrats joined with the Republican majority. House Speaker John Boehner said Republicans are carrying out their electoral mandate.
Keeping a promise. This is what we said we would do. We listened to the people. We made a commitment to them, a pledge to make their priorities our priorities. And when you look at the facts and when you listen to the people, this is a promise worth keeping. Let's stop payment on this check before it can destroy more jobs and put us into a deeper hole.
Also speaking on the House floor, Minnesota Republican Michelle Bachmann sought to portray the health care reform bill as a move towards socialism.
Obamacare, as we know, is the crown jewel of socialism. It is socialized medicine. The American people spoke soundly and clearly at the ballot box in November, and they said to us, Mr. Speaker, in no uncertain terms, repeal this bill.
The vote, of course, is largely symbolic, with Democrats vowing to block the measure in the Senate, where they retain control.
As lawmakers in Washington argue about health care reform, the state of Vermont's taking matters into its own hands. Vermont Governor Peter Shumlin is working with state legislators to create a single-payer system. Governor Shumlin made the creation of a single-payer system a cornerstone of his campaign and hopes to have a plan in place by 2014. He is a first-term governor in Vermont who was inaugurated earlier this month. He joins us now by Skype. We welcome you from Montpelier, Vermont, and want to talk about, as the House of Representatives in Washington this week repealed House President Obama's health care reform bill. Of course, the Senate says they won't go along with it. Vermont went a very different route. You had this rare joint session of the legislature with your whole congressional delegation, and you were addressed by a Harvard consultant, an economist, who laid out different proposals for single payer. You were leading this charge, Governor Shumlin. Why?
Well, you know, I just see it very differently than the Republicans in Congress. I was elected governor to create jobs and to ensure that Vermonters have a better and more hopeful economic future. The biggest challenge for business in Vermont, or one of them, is the rising cost of healthcare. And I think what we want to do here in Vermont is to create a single pool, much like General Motors, Ford, Oracle, ensure that healthcare is a right and not a privilege, and use technology and other methods to contain cost. We want to have universal access. We want to be the first state where health insurance follows the individual and is not a requirement of the employer. I think that will be a huge jobs creator. And most importantly, we have to contain cost. Here's our challenge. Our premiums go up 10, 15, 20% a year. This is true in the rest of the country as well. They are killing small business. They're killing middle-class Americans who've been kicked in the teeth over the last several years. What our plan will do is create a single pool, get the insurance company profits, the pharmaceutical company profits, the other folks that are mining the system to make a lot of money on the backs of our illnesses, and ensure that we're using those dollars to make Vermonters healthy. So a single pool that uses technology to ensure that we get rid of the waste and dedicate those dollars to making Vermonters healthy.
And how would the options that you are looking at differ on the issue of that the Republicans have centered in on, the issue of individual mandates that people must carry insurance?
Well, you know, the individual mandate is going to be important to any success of healthcare. I mean, let's look at what we're doing in this country that every other single country in the world seems to have figured out. You cannot just have a system that is designed to reward providers and others for waste and inefficiency. You can't have a system that is designed, frankly, to reward financially those that do the most to you and not necessarily keep you the healthiest. So there are 3 things that we want our system to do. The first is we're wasting 8 to 10 cents on the dollar in Vermont, and frankly, in the rest of the country, chasing money around. No sane person would do that. We all know what we do. If we have insurance, we get the bill from our provider. Then the Next envelope comes from the insurer. You wait for 4 or 5 of them to build up before you figure out what share you're going to pay as an insured family and what share they're going to pay. That is extraordinarily inefficient. We want to be the first state in the country that has a Green Mountain healthcare card. When you come out of your provider's office, you pay your copay right there on the spot, just as you would never leave the grocery store without paying your bill there. That saves 8%, we estimate, according to Dr. William Shao, right off the top. Then we want to use that same technology to have our health records on that card so that providers can actually know what the last provider did to you when you show up. That will get rid of the duplication and the waste in the system. And finally, we want to be the first state in the country that rewards providers for keeping you healthy as opposed to the number of tests and procedures that they run you through, which happens to be the current system. The current system in America is unaffordable. I think Democrats and Republicans can agree on that. If we stay on the current course, we will be spending the lion's share of our income on healthcare. It will bankrupt our businesses. It puts us at a competitive disadvantage with all of the other countries who figured this out. My vision is that if Vermont can get this right, the other states will follow. Now, I've spoken with the president. We work together with our congressional delegation, with Secretary Sebelius. We need some waivers to make this happen. And what they're saying is, as long as you're not lowering standards, which we're not, we want to work with you. We want the states to be laboratories for change. So it's an ambitious goal. We understand the landmines that lie out there and the special interests and the folks who are profiteering from our healthcare system, but we're going to give it our best shot and try lead the country. Governor
Shumlin, why doesn't it conflict with Obama's health care proposal? What are the waivers you would need?
Well, the biggest waiver we need, and we have an incredible congressional delegation, is Senator Leahy, Senator Sanders, and Representative Welch. But the biggest waiver we need is to ensure that by 2014, we can get the waivers that we need to implement this plan. And really what we want to do is we're not asking for one additional federal dollar. All we're asking is that we are able to pool our federal dollars into our existing system here in Vermont in a uniform system. And I think that'll appeal, frankly, to more conservative members of the Republican Congress. What we're saying is give us local control. Let us go our own way. We're not asking for more federal dollars than any other state. What we are asking is that you let state rights stand up and let us design our own system using those federal dollars as we see fit. And I think that will appeal to, frankly, some of the Tea Party governors that I have just been elected with.
Talk about that. Talk about an alliance with governors who are saying that the federal government should not be involved with this, that this is breaking the backs of the budgets of states all over the country.